So earlier on, we were looking at the different types of drugs used in treating cancer. We looked at biologics. We also have looked at cytotoxic, cytostatic. So there are different other examples. So looking at the cytotoxic now, this is what the cytotoxic drugs entails, and examples of drugs that of course fall under this classification. So when you say something is cytotoxic, it simply means the thing is toxic to a cell, because cyto simply means what, a cell. So these ones were saying that these are drugs that will basically stop cancer progression by being so toxic to the cancer cells. Please let me just take some water. So we see that there are drugs that will directly kill the cancer cells, and they do this by damaging the DNA. They interfere with cell division. They also disrupt the essential cellular functions. So their role in chemotherapy is they're actually traditional backbone of anything cancer treatment. So they usually use them alongside surgery. Maybe I give it before surgery, to weaken the disease, or after surgery to kill the cells that are left. Do you understand? So that's what we do. Okay, so they are used alongside surgery, alongside radiotherapy, okay, and alongside other biologics. So unlike cytostatic that we spoke about, that halt the growth, these ones are what cytotoxic. They will directly kill the cell, okay, the cancer cells, of course. So examples, we have the alkylating agent. Those ones, they form bonds with the DNA. They make it that the DNA is not really smooth again. It's just interlinking anyhow, wrong connection, so to say, leading to the death. So examples, we have the cyclophosphamide, okay, cyclophosphamide, Ifosfamide, Melphalan, Busulfan. They are using all those leukemia, lymphoma, breast cancer. Then we have the antimetabolites. Those ones, they mimic natural metabolites. They disrupt DNA and RNA synthesis, leading to cell death. So drugs like the Methotrexate, the 5-fluorouracil, the Cytarabine, and the MECAP2 purine. Okay, so we also have the plant-derived ones. Okay, they disrupt microtubules. So examples like the Vincristine. We have the Vinblastine. Those ones, they call them vinca alkaloids. We have the paclitaxels. We have the docetaxels. Those are the taxanes, mainly using or treating all those breast cancer, ovarian cancer, lymphomas. So we also have the anti-tumor antibiotics. They basically scatter the DNA. Do you understand? So the cell is not having an intact DNA to keep growing. So drugs like the doxorubicin, the daunorubicin, the bleomycin, and the mitomycin, all these drugs will come back and talk about their individual pharmacologies. Okay, so we have the topoisomerase inhibitors. This one, they prevent the DNA from separating. So DNA is not able to make other copies of itself. So drugs that are like the etoposide, that we have the irinotecan, we have the topotecan. Okay, mainly used in treating all those lung cancers, colorectal cancers, ovarian cancers. All right. So for this type of drugs known as a cytotoxic that will directly kill the cancer cells, these are examples. These are some of the examples. We'll come back and talk about their pharmacologies, all like that. Okay, so that's what we got.